Hi, my name is Ellen Snowball. I'm a research analyst and manager of the Engagement of People with Lived Experience of Dementia, or EPLED, advisory group and cross-cutting program. EPLED is part of the Canadian Consortium on Neurodegeneration in Aging, or the CCNA. I'm also studying to become an art therapist at the Canadian International Institute of Art Therapy, or CIAT. Today, we're going to look at stress and how it impacts health for people who have dementia and their care partners. We have a lot to cover, so let's get into it. What is stress? Stress is a state of tension and strain when a person experiences tangible or perceived pressures or demand. Stress can affect our mental, emotional, and physical well-being. A period of stress can emerge in response to a stressor or a source of stress. Stressors can include things like being diagnosed with dementia, experiencing symptoms related to a diagnosis, experiencing stigma related to one's diagnosis, having a loved one diagnosed with dementia, or caregiving for a loved one with dementia. Not all stress is bad, though. Let's learn about some different types of stress. Eustress describes a type of good stress that can be enjoyable. For example, looking after hyper grandkids may cause some stress to keep up, but it's really nice to see them smile. Neustress describes a neutral type of stress. Neustress isn't enjoyable or taxing. For example, hearing about some bad news on the television. The news might stress you out a little, but it's unlikely to affect you directly. Distress, on the other hand, is bad stress. Distress is a harmful experience that can cause illness. It can affect your mental state, your emotions, and even your physical health. For example, a recent diagnosis with dementia may cause an emotional response, such as becoming anxious or depressed. Chronic stress is stress that is consistent. It can be a feeling of pressure and demand that occurs over a long period of time. You may feel this mentally, emotionally, or physically. For example, caring for a loved one with dementia may bring consistent daily pressures. Acute stress is a reaction that occurs after a stressful event. The reaction develops quickly, but does not last long. For example, forgetting a coffee date with a friend may be upsetting. However, it is likely that your friend will understand and set up a new time with you. Some stress can be good for us by keeping us active, like keeping up with the grandkids. But stress that is long-term and intense can be damaging to our health. Let's learn about some fields of study that look at stress and health. Health psychologists study the link between psychological, emotional, and physical health. They look at how stress can negatively affect us in many ways. For example, some health psychologists may study how stress can impact the progression of dementia. Environmental psychologists examine how human behavior is influenced by environment. For example, environmental psychologists may study how toxic gases like fumigants can lead to an increased risk of dementia. We all react to stress differently, and many of us have our own ways of coping with stress. However, there are some similar ways we deal with stress. Let's learn about them. General adaptation syndrome is a theory that describes common responses to stress. This model consists of 3 stages. The alarm reaction, such as the fight or flight reaction, the resistance stage, such as freezing, the exhaustion stage, such as physical deterioration. The fight or flight response was coined by Walter Cannon in 1929. It is a common response to prolonged or excessive stress. When a stressful event occurs, like getting diagnosed with dementia or getting into an accident, an automatic reaction is triggered that makes the body ready for defense. This alarm reaction is triggered by the brain and regulated by the sympathetic nervous system. It pumps blood to the muscles for quick action. It also alerts the adrenal glands to secrete adrenaline, speeding up the heart rate and increasing blood pressure. Fight or flight is theorized to have begun with our ancestors, who had to fight or run away from predators. If we can't fight or run away, we enter what is known as the freeze response. It is marked by bodily preservation, such as saving energy or total exhaustion. The freeze response is ruled by the parasympathetic nervous system. It is responsible for shutting down arousal, slowing heart rate, and relaxing muscles. So what are some life events that can cause stress? Let's learn about different kinds of events that may cause you to become stressed. Catastrophes are events that cause great and sudden damage, such as natural disasters, war, accidents, and abuse. The stress caused by catastrophes can lead to mental health problems, such as post-traumatic stress disorder. In 1941, a psychiatrist named Abraham Gardner first described symptoms of post-traumatic stress after studying World War I veterans. Post-traumatic stress disorder is characterized by flashbacks, nightmares, severe anxiety, and intrusive thoughts. Burnout is a state of extreme emotional, physical, and mental exhaustion. It is due to prolonged or excessive stress. For example, burnout can occur among caregivers of people with dementia. It can reduce productivity or lower motivation to complete tasks, causing feelings of hopelessness and resentment. People who have burnout feel drained and tired most of the time and may begin to withdraw from others. Significant life changes are major life events that can cause stress. They can put pressure on a person to adjust to new circumstances. Both negative and positive life changes can be stressful. However, positive life changes seem to be less disruptive than negative ones. For example, receiving at-home care might be hard, but it could make a positive impact. Most life changes are considered acute. This means that they occur suddenly and the individual adjusts fairly quickly. Daily hassles are events that cause short-lived states of stress. For people with dementia, this may include misplacing medication, forgetting someone's name, or losing balance. For caregivers, this may include organizing medications, making meal plans, and managing car rides. Even though daily hassles are short-term, they can still affect our well-being in negative ways. Daily hassles can affect our life satisfaction, including our mental and physical health. Stress has been shown to affect the immune system. The immune system acts as a defense system against disease, with white blood cells killing viruses, bacteria, and fungi. Research has shown that stress can reduce immune functioning, making people more susceptible to disease. In his book, When the Body Says No, physician Dr. Gabor Mate has researched how stress can lead to disease, including cancer and Alzheimer's disease. Mate talks about how consensus is growing to consider Alzheimer's disease an autoimmune condition. Autoimmune disease happens when the body's defense system can't tell the difference between normal cells and foreign cells. As a result, the body attacks the normal cells, causing illness. Autoimmune disease also entails imbalances in the body's ability to regulate stress. This includes the hormone cortisol, the body's main stress hormone. Studies have shown dysregulated stress responses in people with Alzheimer's disease. Some people with Alzheimer's disease produce more cortisol than normal. Other studies show that stress has been linked to an increased risk of developing dementia. Stress can also lead to accelerated levels of cognitive decline. Stress can have an impact on other areas of our body. Here are a few health conditions linked to stress. Stress has been shown to affect the heart. Chronic stress can increase inflammation in the body, leading to high blood pressure and lower good cholesterol. This increases the risk for heart disease and heart attack. Stress has been shown to affect HIV/AIDS. Studies have shown that chronic stress can work against human immunodeficiency virus, or HIV, treatment. It can increase the likelihood of HIV progressing to acquired immunodeficiency virus, or AIDS. Stress has been shown to affect cancer. Stress can weaken the immune system, increasing the susceptibility to cancer. Studies show that exposure to stressful events can increase the risk of developing some forms of cancer. Stress has been shown to affect psychosomatic disorders. Stress has been linked to somatoform disorder, which is characterized by physical complaints that cannot be explained by physical causes. Everyone copes differently with stress. Coping describes how we deal with something that is difficult. There are several different types of coping styles. Emotion-focused coping describes a style of coping that attempts to minimize emotional responses to the stressor. So rather than deal with the source of stress directly, you may wish to ignore it. Denial or using medication to reduce anxiety would be an example of emotion-focused coping. Anticipatory coping is a coping style where a person begins to worry about stressors before they have even happened. Worrying about a doctor's appointment ahead of time is an example of anticipatory coping. Problem-focused coping is a style of coping where the person faces the stressor. They can do this by finding ways to reduce or change the source of stress, or modify their behaviors toward the stressor. For example, a person who is worried about their doctor's appointment may choose to meditate. Social connection has been shown to mitigate the effects of stress. Social connection includes social networks, the social relationships that surround us, social support, the emotional, social, physical, and financial help we give to and get from others, social engagement, taking part in activities with others in our social network, social connectedness, feelings of belonging and being cared for. Studies have shown that social connection is linked to mental health outcomes. This includes depression, cognitive decline, and behavioral symptoms of dementia. Progressive relaxation can help with stress levels. It teaches people to tense selected muscle groups, such as the neck muscles, thighs, or facial muscles, then relax them. This helps people to recognize when their muscles are tensed or relaxed and help focus the mind. Meditation has also been shown to moderate stressors. Transcendental Meditation promotes a relaxation response. It reduces the body's metabolic rate and blood pressure. People who meditate also have more alpha waves, which are associated with relaxation. Exercise is a great way to cope with stress. Exercise increases endorphins, which are the brain's feel-good chemicals. It can help your body get out of a fight or flight response and support your cardiovascular, digestive, and immune system. It can improve mood by helping to promote relaxation and ease symptoms of anxiety and depression. Making art can help reduce stress. Creative arts such as drawing, painting, or photography can help you feel better. Studies have shown that these activities reduce stress and anxiety. Thanks for listening to this introduction on stress and dementia. If you have any comments or questions, please feel free to forward them to ellen.snowball@uhn.ca.